Ladies and gentlemen, World Hypertension Month alerts all medical practitioners to the importance of proper diagnosis and effective treatment. In our commitment to public health and professional service, IPCA proudly presents a daily take-home message throughout this month. These insights are provided by the eminent Padmashri Dr. C. Venkata S. Ram, a global legend recognized for his pioneering contributions to our understanding of hypertension. Listen to Dr. C. Venkata S. Ram's today's message.
Greetings to my fellow medical practitioners all over the country. In connection with the World Hypertension Month of May, I have been giving one important, simple message of the day for last 30 days. For the last 30 days, I have been giving a message to cover the spectrum of hypertension, the importance of hypertension, diagnosis of hypertension, outpatient diagnosis of hypertension, how to measure the blood pressure properly to make the diagnosis of hypertension, and how to get ambulatory blood pressure monitoring if needed, how to measure home blood pressure if needed. Then I covered about the lifestyle changes for the treatment of hypertension. I gave you the classification of hypertension. I suggested that the blood pressure goal for most patients should be less than 130 by 80 millimeters of mercury. In elderly patients, I have suggested that the goal should be less than 140 by 90 millimeters of mercury. I talked about uncomplicated hypertension. I talked about complicated hypertension. I talked about secondary causes of hypertension. I talked about hypertensive emergencies. I talked about hypertension in pregnancy. I have suggested various treatment modalities that are available, lifestyle changes, non-pharmacological treatment, ideal diet for the treatment of hypertension, and we talked about the role of pharmacological treatment if lifestyle changes do not work or they're not sufficient to lower the blood pressure. You have a wide variety of quite effective antihypertensive drugs for the treatment of hypertension, which can be used either as monotherapy or in combination therapy, which is highly recommended. I talked about diuretics in the treatment of hypertension and the recent advances in the diuretic therapy for the treatment of hypertension and the guidelines showing a preference towards chlorthalidone over hydrochlorothiazide among the diuretics choices for the treatment of hypertension. Similarly, among beta blockers, I talked about the guidelines preferring cardioselective beta blockers such as metoprolol or bisoprolol for the treatment of hypertension. Among ACE inhibitors, I have suggested using a long-acting ACE inhibitor. I mentioned, in my opinion, ARBs are superior to ACE inhibitors for the treatment of hypertension. Among ARBs, long-acting ARBs such as telmisartan is particularly preferred based upon the outcome trials using the optimal dosage, etc. In the calcium channel blocking drugs, I talked about mainly dihydropyridine calcium blocking drugs such as amlodipine and the new generation calcium blocking drug ezellodipine. I mentioned that both amlodipine and ezellodipine are equally effective in the treatment of hypertension, but the new generation calcium channel blocking drugs such as ezellodipine, which are highly selective, they reduce the blood pressure as much as amlodipine, but providing freedom from amlodipine side effects such as ankle edema and uh, adverse effects on the kidney. So one should choose calcium blocking drugs not only for their efficacy, but also on their ability to provide freedom from side effects. Choosing the drugs based upon the evidence is very critical indeed. I mentioned on how to select the drugs based upon their clinical profile, based upon the outcome trials, and based upon the guidelines recommendations. That is what I have used as a scientific basis for selecting antihypertensive drugs, either as monotherapy or combination therapy. Choosing the drugs based upon evidence, ladies and gentlemen, is very critical indeed. By following the principles which I have covered daily for the last 30 days, you should be able to control hypertension effectively in your clinical practice. And you can do that by selecting the drugs properly, by proper combination of antihypertensive drugs, by proper dosage, by proper titration, etc. By using the principles which I have covered in a nutshell in the last 30 days, ladies and gentlemen, as wonderful doctors as you all are, you should be able to control the blood pressure in uncomplicated hypertension as well as complicated hypertension as well. And towards your effort and towards your mission of controlling the blood pressure effectively in your patients and in your communities, I offer you my good wishes and my full support in your desire to eliminate the consequences of hypertension in the community. I offer my full support and understanding of your keen desire to diagnose hypertension properly, to treat hypertension properly, and to prevent the damages from hypertension and to prevent the complications of hypertension. All of you are so well trained, well educated, highly trained, and you are all capable of lowering the blood pressure effectively in your clinical practice. And towards that extent, I offer my good wishes and my support. I hope the messages that I have given all this month, 31 messages, are useful for you in clinical practice. Again, my very best wishes to you, your patients, to your country, and also to protect the public health. And I thank IPCA for providing a forum for all of us as a reminder how blood pressure is very important in clinical practice and how this World Hypertension Month of May is a reminder to control hypertension aggressively. IPCA has given us the tool for the daily messages, and which I hope will be useful in further improving the blood pressure control in the communities. And I thank them for providing us this wonderful scientific platform. And I'll conclude with today's message. All the messages that I have given during this month of May as a World Hypertension Remembrance May, and as a reminder of the importance of hypertension as a risk factor and how we can reverse it by appropriate management. Thank you for listening to me for all these 31 messages, and thank you for your attention to my clinical suggestions that I have made. Thank you very much.